In other news we're following for you this afternoon, stroke is the leading cause of disability in the U.S. Every 45 seconds, someone in our country has a stroke. May is National Stroke Awareness Month, and Dr. Cheryl Bushnell, a professor of neurology with Atrium Health Wake Forest Baptist, is joining us live this afternoon. Dr. Bushnell, thank you for being here. Let's first talk about some of the signs and symptoms of a stroke folks need to be aware of.
Absolutely. So thank you for having me. A stroke is when there's a sudden loss of blood flow and a lack of oxygen to the brain, and that causes symptoms that refer to that area of the brain. And so there are a couple of different ways that we're trying to educate people as to recognize these symptoms, and one of them is B FAST. So the B stands for balance loss. If you suddenly can no longer walk. The I stands for eyesight changes. So in other words, if you have double vision or you can't see out of one side of your vision. The F is for face drooping, so if one side of your face droops. The A is for arm drooping or arm weakness, the S is for speech, and the T is for time. So always important to keep track of when all of these symptoms started. So B FAST is a really good way to sort of summarize the major stroke symptoms.
And Dr. Bushnell, we know unfortunately there are some genetic risk factors people cannot change, but what are some things we can all do to help with prevention?
Absolutely. So one of the most important things is if you have high blood pressure or diabetes, to get that under the best control possible. The other thing is if you smoke, stop, because that is one of the major risk factors for stroke. It damages the blood vessels. Obviously, it's bad for the heart as well. And then limiting alcohol, exercising regularly, eating a healthy diet, all of those things will actually help with blood pressure and diabetes at the same time. And for those who really need to take blood thinners, they should take them on a daily basis. So all of those things can help reduce the risk of a stroke.
And as many of our viewers know, Wake Forest Baptist and Wake Forest School of Medicine is an academic learning health system, which means patients do have the opportunity to enroll in a wide variety of clinical trials. Can you speak about those?
Absolutely. So we actually were just awarded $30 million to study 2 different ways of managing blood pressure after a stroke. And so this is by the Patient-Centered Outcomes Research Institute. So we're looking at whether just coming to clinic, getting your blood pressures measured, and then adjusting medications is worse or better than a really cool technology using digitally transmitted blood pressure readings to a team that can then look at those readings and make adjustments via telehealth. So you can save the patient from having to drive in. So we're looking at whether those 2 strategies can work best for stroke patients, especially 3 different subgroups: the African American population, which blood pressure is a major issue, and stroke risk is a major issue, and then people over the age of 75 and people with disabilities. So we just want to be able to try to find the right way to manage blood pressure in these groups of people.
You are leading an interesting study among several medical centers and universities throughout the Southeast, also known as the Stroke Belt. Explain to us what that is.
So the stroke belt is actually an area of the country where the risk of stroke and the chance of dying from a stroke is about 20 to 40% higher than the rest of the country. And so we know that probably one of the main reasons for that is chronic diseases such as blood pressure, diabetes, high cholesterol, heart disease, heart failure. All of those things sort of lumped together in one person. If one person has all of those things, their risk of a stroke is much higher. So we think that that is one of the major reasons for the stroke belt. And of course, there's certainly a diet that's associated with the stroke belt as well, with high-fat diets and fried foods, but really it's more all of those chronic diseases.
Dr. Bushnell, we certainly appreciate your time. Thank you for joining us, especially during Stroke Awareness Month.